I think when I think about the challenges of living through this past year, a few things come to mind. I think the first one is the length of time. It's really hard to be patient and kind and supportive in the long haul, especially when the things that we turn to in order to feel restored, hobbies, social contacts, vacations, aren't available to us. It's difficult to be able to fill ourselves up in order to give more and more during a pandemic when less is possible. I think the second thing is really loss of control. Many of the things that we do to give our lives meaning, we can't do. And more importantly, whether or not we do them is no longer our decision. So we can't decide to go out and see someone or do a particular activity if we're all living under this pandemic management where some things are just not possible. Generally, most of us do better when we have control over the good and the bad events that life has to offer. And then finally, in terms of challenges, I would say that the things we need to do to manage the biologic aspects of the illness are the ones that make managing the psychosocial aspects of the illness so difficult. So leaders and decision makers have not always weighed their decisions with this balance in mind. For example, we may know that the transmission of the virus outdoors and at a distance is low, but out of caution, we may restrict it. On the other hand, we know that restricting all forms of social activity has a very significant impact on mental health and well-being.